Welcome to another episode of Spotlight on Scholarship. Today we have with us Dr. Diener and Dr. Livingston from the Kramer School of Nursing. They're going to be speaking to us today about their scholarship. So we'll get going. Thank you for joining us.
Thanks for having us.
So what does DNP stand for? And talk to us a little bit about research within the DNP practitioner's field.
DNP is Doctor of Nursing Practice. What we offer are clinical tracks for those nurse practitioners who are already certified in one area and want to obtain a doctoral degree. We have a community-based public health track for people who are really interested in improving the health of the community. And we have an executive leadership track, which Dr. Diener developed, with focused on organizational leadership and or educational leadership, administrative positions in education, that type of thing. Research within the DNP realm is translational research. We take the evidence produced by the PhD and put that into practice. It takes a very long time for new evidence to be put into practice.
Let's jump over to the PhD realm. So talk to us a little bit about research and what research looks like in the PhD track.
The research that's done in the PhD track looks a lot different. PhD goes across many disciplines and of course many outside of healthcare and healthcare. And what makes it a little bit different from DNP programs is that the students who are in the doctoral program choose their own focus. So whatever their passion be, whether it's in practice, a particular disease entity, if it has to do with teaching, might be ethics, they choose where they're going to focus their research. What is different and sort of complementary at the same time is that for the PhD it has to be original research. So they spend a portion of time learning about both qualitative and quantitative research methodologies, and they also spend couple semesters in statistics so that they are well versed in constructing and then conducting a study. And then of course dissemination of their research, so making sure that it gets out into the literature and eventually into practice.
Have there ever been any collaborations between students and the programs where you will see a practical example of evidence-based research that's translated?
I have a PhD student now and then a DNP completion student whose project I'm chairing. And it has to do with AI, artificial intelligence, how one, we use it in the classroom, and two, then how do we apply it in monitoring of patients in the hospital. On the DNP side, it's to predict respiratory decline, so those who are at risk for having an emergent event while they are hospitalized and picking up on triggers for that. And the one that the PhD student is doing is looking at nurses' involvement in design. So here we have because lots of our AI applications are developed by outside designers who are not a part of healthcare. And nurses' adoption of AI is expected to be better if they have some say in the design and it becomes a very practical tool for them. Here we have a DNP student who's doing just that because she's come back for her doctorate, her DNP, but she is an intensive care and acute care NP provider in the community. So while they are not collaborating necessarily on the same project, or the same application, that you can see where they're parallel.
Tell me about how your research translates into the OCU classroom.
My love is transcultural health. Directly, my project was related to improving cultural humility among primary care providers. That experience, that love, however you want to say it, directly translates to how I teach students to work with people. We're a very, very diverse country. We have very diverse patient populations. We need to take each person as they are, find out about them, those experiences, and the more that you learn helps you be a better provider.
I am particularly interested in qualitative research and also mixed methods. And so bringing that into the classroom, just putting some of what has emerged, maybe from prior students, or prior research participants, and they're describing what their experience as a student has been like, affects what I am going to do in the classroom.
Well, thank you very much for joining us, and tune in next month for our next version of Spotlight on Scholarship.